I have been in this journey for 25 years now. I was diagnosed when I was 12. So I was a normal 12-year-old going through all the 12-year-old girl things, and I just immediately got sick. Every time I ate, it would hurt. Like I would have a lot of pain. I would have to go to the bathroom. Nobody knew why. Everyone was really scared. I was scared, but I also had this part of me that just wanted to be a kid. I just kind of stopped. I would try to avoid food a lot, or try to eat really slow so that I could just be normal. Once we got the diagnosis of Crohn's disease, we never heard that term before, and we didn't even know what it meant. Like, what does this mean? What's going on? Just looking at the pamphlets in the hospital and feeling like I'm this 12-year-old Black girl growing up in Texas, and no one on any of the pamphlets looked like me. And I remember one time just feeling like, how did I get this old white man's disease? Like, there are no Black people in these pamphlets. There are no young people on these pamphlets. There are very little women on these pamphlets. Thinking of like my lowest moments with Crohn's and then my lowest moments with Hidradenitis Suppurativa. That diagnosis came years later, and having to already navigate one chronic illness, once I realized and got a real diagnosis for hidradenitis, I realized I was misdiagnosed for 10 years. That was also isolating because there wasn't a lot of information about it out at that point. So on one end, there's information, but no representation. And then on the other end, there's just silence. And so they both felt isolating in different ways for me. What I wish people understood about chronic illness is that it touches every part of your life. It's not just a stomach disease. It's not just a skin disease. It's not just an eye disease or a thyroid disease. This really impacts how you show up in all of your spaces. It's like carrying an invisible book bag full of rocks where everyone can see the impact of what you're carrying, but they can't see what's actually causing your pain. The insurance barriers to my care were the Copay Accumulator programs, because when I first were introduced to them, I was a college student or like newly working. So I thought this was something good, like, thank you all for giving me this assistance. I didn't realize that I was not going to be able to reach my deductible on them. Yes, I had the access to the medication, but I also still had hospital bills, and I never reached the deductible to the point where I could experience savings. And so that really did not give me enough financial breathing room. Sometimes I would delay care. When I had injectables, I would miss a dose if I had to pay a bill, or if I had to had another need I had to take care of. And it really caused me to get sicker a lot of times when you push back your medication, or you're having to decide between going to the doctor or getting this injectable or getting some food. Had I not had that experience and my copay was able to go to my deductible, I would have continued my care, which would have resulted in cheaper bills, cheaper medication, medical bills, and just like cheaper costs in the healthcare system all around. What I want people to understand is that we just want to live a happy life. We want to be able to be well as possible. And the medication that we have is a life changer for us, and having access to that medication helps us to do those things. I don't want people to have to deal with trying to decide between their groceries and their medication, or going to their doctor that they know, versus waiting until something gets really bad and having to go to the emergency room. That's part of that dignity, that human dignity that we all deserve, is to be able to make the choice that's best for us to help us be healthy.